Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice. Hi, everybody. Chad Madden here with the Grow Your Practice podcast. And today we're going to be talking about all things RTM with Steven Liska with Limber. So the reason that I very much am excited about this is because here at Madden Gilbert Physical Therapy, we personally use Limber. And anyhow, welcome to the podcast here, Steven.
Thank you, Chad. Appreciate it and been looking forward to it and happy to be talking to you.
Awesome. Do you prefer Steve or Steven?
No preference.
Okay,
with your
great.
gut. Yeah.
All right. I have a brother named Steve. We'll go with Steve.
Okay.
Cool. So I know the first time we met, Steve, you talked about your physical therapist first and foremost. Can you talk about how you went through, being a physical therapist, what roles you've had in your career, and then ultimately how you ended up at Limber and why you decided to get involved with RTM?
Yeah, absolutely. And yeah, kind of what's turned into kind of a unique path. Went to my undergrad is in athletic training, went straight into PT school at Northwestern here in Chicago. That's where I'm from. First job was a corporate large, kind of enterprise PT group. And I realized pretty quickly that wasn't where I wanted to be. And so then after just a few months, went into private practice, not went into like opened my own, but took a role with private practice, single location. And that's where I spent my career. Lived in Colorado for a couple of years, but in both places was working for small private practice, just a handful of locations. And those are my people. That's where I like to be. But kind of got to a point where was looking for opportunity for a little more growth. Probably a little too risk averse to start my own practice. And it's funny. I should thank you for the work you're doing in general, right? Like I attended your event in October, and I think I maybe even mentioned this to you at the time that had I gone to an event like that or had tools like that, maybe I would have been, thinking a little harder about pursuing my own practice. I left that conference. It's like, well, maybe I should have looked into that because it was inspirational. So all being very sincere. So thank you for what you're doing for private practice owners. But anyways, I chose to kind of look for something a little different. I wound up applying to this clinical leadership role with a large medical supplier, interviewed with them, found out I was a little bit late and that role had already been filled, but they liked me well enough that they asked if I would be interested in taking a sales role with them. They were going to kind of create a sales role for me. And definitely nothing I ever would have applied to or searched on Indeed or anything like that. But it was like, hey, let's go for it. I'll learn something new, right? And so I did that and wound up being a good fit and worked out well. I wound up spending a few years there managing a team of other sales folks, mostly selling therapy and rehab equipment and supplies, right? And then wasn't looking, but was approached by one of the founders of Limber and was immediately into the mission. Right. So I didn't take any convincing there. Wound up being kind of a tough choice. And eventually I made the decision to join Limber mostly because of that. Right. It was a more direct way to impact the profession in a positive way and specifically private practice owners. Right. I know the challenges. I know about declining reimbursements, all that stuff. And so to have an opportunity to bring something that offers a little bit of relief, I kind of jumped on that. And it's been a really good move so far.
Awesome. Appreciate the story. Anything that you want to add in for you talked about the founder of Limber? How long has Limber been around? Any of the backstory behind the company, how it came to be, I think would be for the listeners.
Absolutely. Would love to. Yeah. So we've had you'll notice I say we and our, like I've been here like a year, but I take credit for everything that happened, going back. So we've had a company since 2019, even though these RTM codes weren't reimbursable until 2022. So it was actually our founders who played a very large role, along with the AMA, in creating these codes and submitting for their approval. So we had a few years there, waiting, hoping that they're going to be approved. Built out our model, built out our team, built out our platform. Actually did a couple studies at the Mayo Clinic, and that way we were able to kind of hit the ground running last year once these were reimbursable. And so that's kind of the background of Limber. And so, I'm very straightforward with everybody we talk to. We feel like we understand RTM as much as anybody can. That said, it's still new for everybody, us included, and we're still learning all the time. And it's an innovative thing.
Great. So before we get into the market trends and main pain points that owners are having and why they're looking to that, a couple reference points. So I did have, I forgot about this, Brad Saunders on,
That's
who
right.
you
Yeah.
recommended. He did do a podcast episode for us a few months ago. So for listeners, you can go check that episode out. That is Brad Saunders, clinic manager, practice director, I believe, in the Carolinas. Do you remember the name of the practice?
Coastal Carolina PT, I believe. Yeah, and he oversees several sites. Mm-hmm.
Yeah, I believe they have 10 total. And Brad did an amazing job talking about how they rolled that out. So make sure you check that out. For those listeners that are new, what is RTM? How did it come to be? And how's it being used in the marketplace right now, Steve?
Yeah, please. That's what we really want to talk about and get the word out, right? And again, wasn't there in the very early origins, but I usually like to use some numbers, some research to kind of explain the problem, kind of some depressing statistics, frankly, but then more hopeful stuff. So the research, there's a few different articles out there. Some show that 80% of a patient's outcomes are determined outside their visits, right? Outside their time in the clinic, which makes sense. 95% of their time, even if you're seeing them a couple times a week, is not with you, right? And also 80% of information that patients are told is immediately forgotten, which is the most painful one for me, because I used to love patient education. You think you do a great job, and some of this is just, kind of in one ear out the other, right? So we think we're setting patients up with these great tools to go home with, set them up for success, but these kind of things make it translate to less than 35% of patients that are adherent to their home exercise program, right? You can come up with all the best exercises for them to do, and as we all know, they're not doing it, nothing's happening. The good news is there's research out there that shows that communication between visits, regular check-ins, things like that, lead to a drastic increase in HEP adherence, like over 90%. And so that's kind of the problem RTM is trying to solve, right? But if you're going to try and solve it, you need something that's going to demonstrate improved outcomes, first of all, but going to be a better patient experience, or at least a good patient experience. And then also some revenue tied to it, right? If you're going to have practice owners do something new, implement new things, put time and energy into that, it's got to be reimbursable. And so the result of that was these RTM CPT codes, right? So what if there's codes out there that can be utilized to reward or incentivize therapists for following up, checking in with their patients between visits to increase that likelihood of success?
Awesome. So can you get for those that are new to RTM and understanding that, what would be so average case, average reimbursement per patient coming through? Can you talk through some use cases there as well, and what an owner could expect for the effort that they're putting forward to monitor in between visits?
Yeah. And I suppose I didn't even really get into like what actually is this, what is RTM? And so it's we're using these codes, but it's during an active episode of care. So I want to be clear about that, right? This is not after discharge or anything like that. This is in conjunction with their normal episode of care, and their normal in-clinic episode does not need to change. This is not telehealth. This is not replacing those visits. It's very much set up to complement that in-clinic care. And so this goes on during that active episode of care. It can last as long as the episode of care is going to last. The regulations are we can do RTM. You can monitor patients only up to 30 days without a therapy visit. So you do need to be seeing them for actual therapy visits, periodically. And so, what that translates to in terms of reimbursement, is that kind of what you were asking, Chad?
Absolutely.
Yeah. So of course, it varies a ton by level of engagement, how the length of their episode of care, but it's pretty regular for us to see an engaged patient translating to over $300 in additional reimbursement from RTM codes throughout their whole episode, not per month, throughout that episode of care. If it's an engaged patient communicating, that's normal to see.
Great. And then I'm going to probably oversimplify here, but in the last year or so, in talking with various RTM companies, I see and what we enjoy about this is, okay, sorry, I got ahead of myself. Two different RTM categories. One is where the therapist is handling pretty much everything. right? And there are a few companies doing that. And then what we love about working with you and your team is you actually appoint a clinician to handle a lot of the communication between the visits as well. So can you talk about those two schools of thought, and ultimately, who is the type of practice owner other than me that is looking at Limber as a solution?
Yeah, so definitely I can elaborate obviously more on that white glove approach, because that's the model we utilize. But I want to be very upfront, right? It's not right for everybody, and we're really clear about that when we discuss that with folks. If you're with a practice and you want your therapist monitoring their own patients, you feel like they have time built into their schedule, you're going to build time into their schedule to do that, to check in with patients, more power to you. Definitely go for it, and there's solutions out there for that. There are certain billable milestones on the codes that you need to hit in order to be able to bill them. So you just have to make sure you're setting yourself up for success there, that therapists have enough time to interact with those patients.
What would be an example of that like a
Yeah,
mile?
so the RTM minutes, right? Most of that time we spent, or we think about as far as the communicating with the patient, those are in 20-minute increments, right? So every 20 minutes, you're able to bill. If you do 19 minutes of monitoring in the month, you're not billing anything as far as those RTM minutes go. And that's 2 out of the 4 codes that we utilize that applies to. And then there's 2 other codes that have a caveat that the patient needs to transmit data for at least 16 out of a rolling 30 days. And we can get as much into the weeds on this as you want. You probably don't want to go too deep, but basically, if they're not transmitting data through the app, or whatever kind of program they're utilizing, and they're not using the service or the platform, you're not going to be able to bill for that patient.
Got it. So just out of curiosity, I didn't plan on asking this question. Any early data that you have from RTM so far in terms of better outcomes or anything like that ultimately you can, that we as an industry can take back to the insurance company in the future? Any trends that you're seeing there?
Yeah, absolutely. So let me answer that, and then I'll go back to actually getting into our kind of, more white glove approach that we take. Yes, so it's early. We've collected data, and we have clients who've collected data and shared some of it with us. And so more to come for sure. We're very big on outcomes collection. But thus far, very, very positive trends. So improved outcomes, first of all, for sure, like 7 out of 10 patients. And this is, we've combined this from a few different studies, but about 7 out of 10 patients meeting their minimal clinical important difference for either pain or function. So majority of patients having a really positive improvement. And then just talking about, numbers from various groups that are not just tied directly to outcomes, but we've seen increased arrival rates, decreased cancellation rates, decreased drop-off rates, right? And so less patients self-discharging after only 2-3 visits. And it makes sense. People are more invested in their plan of care, right? They have people following up with them, people checking in with them. And so what we've seen also, it's kind of interesting, but again, makes sense, is the total number of visits for the episode has floated right around the same. And so it's like, well, if people are coming more and they're canceling less, how is the number of visits not going up? And it's because people are getting better faster, right? So Mr. Jones goes from 12 visits to 10 visits, but Mrs. Smith made up for that because she went from 3 visits to 10 visits. And so really, really positive trends thus far. And like I said, more to come for sure.
Great. Love that point, and never thought about that before. So that's a great one. As practice owners, the biggest challenge that many of us are facing right now is, the declining reimbursements, increased cost of doing business, and then in the end, what does that mean? Shrinking margins. So this is it sounds like you're saying this is a very straightforward way for us to better serve the people that are coming through, getting more compliance, and ultimately lifetime customer value for us across the board. So appreciate that. The thing that I probably have seen owners with struggle with the most, and myself included, I hope you didn't look at our utilization numbers before you hopped on here, but when we're managing 45, 50 clinicians, rolling out a new program such as this is often perceived as more work. You and I had talked about this in the fall in Denver, and that's how we ended up talking with Brad because I'm looking for practice owners that have rolled this out successfully and have the highest utilization. What are you seeing in common with the clinics that have the highest utilization of Limber and ultimately RTM within their practice that have done the most successful rollout, so you can help the stragglers?
Yeah, great question. And we're getting better at this all the time, as you can imagine, right? Because we're learning, every organization's different and we need to bring different things to the table that click. And so what you alluded to before is we take this very high touch approach where we are actually providing the staff to do the monitoring. Our whole, where we're going after is we want the workflow in the clinic to change as little as possible. So therapists are able to enroll people. Our care navigator reaches out, which is a licensed PTA or PT, depending on the state. They reach out and they're handling all the monitoring. We are very straightforward that it is still that therapist plan of care, right? So this care navigator, we call them, will never update the plan of care. They'll never update the HEP. They very much become part of the team with that in-clinic provider. They're communicating everything back to that therapist so that the therapist has full insight into everything. This care navigator is purely in a supporting, motivating, coaching kind of role and really just kind of eyes and ears for that therapist out of the clinic. But to answer your question, provider engagement, we call it, that's our biggest challenge and therefore our top priority with every decision we make, right? We need therapists to buy in. Yes, they're not doing the monitoring, but nothing works if they're not enrolling appropriate patients into RTM and telling them, hey, Jennifer, your care navigator is going to be reaching out to you in 24 hours. She's awesome. You're going to love working with Jennifer. She's going to help support you with your program at home, right? And every clinic knows exactly who their care navigator is. Like I said, they become part of their team. It's not some robot, reaching out. But of course, that takes, a little bit of, you got to present it the right way. And to answer your question 5 minutes later, it's top-down messaging. The messaging from the top, how it's presented, not mandated, like you're going to do this and you're going to like it, right? It's, here's why we decided this is going to be really good for our practice. Here is how your patients stand to benefit from it. And what I'll say is, as soon as that therapist enrolls somebody and that somebody comes back and tells them about their experience with the care navigator, we're good. We're good. It's just a matter of getting that initial kind of, hey, give it a shot. This person is going to complement your care.
Right. Yeah, I'm very much looking forward to more transformation amongst clinicians as we go along here. So more the industry has hope, because I do think the hybrid model, both supporting people live in a bricks and mortar practice and then supporting them online is the trend that we're going to see in the future. Final question here, specifically to RTM, Steve. The one concern that you and I've talked about in the past, I've talked with other RTM providers with as well, and this is a tough one, is, to me as a business owner, as a practice owner, relying on, insurance companies for reimbursement, very challenging to get them to meet our rising costs in order to provide care. And at the same time, if we look at, CMS or Medicare reimbursement, that's decreased roughly 10% over the last 5 years, while our costs have gone up significantly. Yet again, through RTM, I haven't seen anybody charging cash for this yet, but I'm sure it's the possibility in the future. Can you talk through how you think through, we're relying on the insurance companies for reimbursement. We've already had declining reimbursements over the last few years. What's keeping the insurance company just from pulling out the rug underneath us? And then we're providing RTM and then tomorrow it's not reimbursed. How do you think through that?
Yeah, great question. And hopefully I can answer that well, because we try and really position ourselves here as a leader in this industry. And going along with that is discussions and negotiations with payers to get wider acceptance. And there is, right? So there's over 30 payers now we've seen covering this outside of Medicare. And of course, there's nuances and it's messy, right? But the point is there's more and more payers coming on board with positive policies and RTM and things like that. But Medicare kind of sets the trend. And so we have to show positive outcomes with Medicare patients for these codes to stick around. They have to be utilized and we have to have good outcomes. But ultimately, the way I rationalize it, or really what we're trying to do with these codes and with our model and our practices, help push the industry towards more of a value-based care model where clinicians are, incentivized for the quality of care that they're delivering, right? And so what we're trying to prove and proving thus far in our numbers is that, hey, yeah, it's worth to Medicare, it's worth it to insurances to pay a little bit extra reimbursement to help increase the chance of success with conservative care, if that means they're avoiding the costs of unnecessary injections and unnecessary surgeries and unnecessary imaging and unnecessary prescriptions, right? And at what your show you guys put on back in the fall, you had, I don't know if you have the number on you still. I would love it if you did. Although I don't want to hear it again, I think I audibly gasped at the cost of musculoskeletal care in this country, or what's spent on in a year. It was like made you sick to your stomach. And so, you got the number?
Oh yeah, it's so 2021. What I had shared in Chicago at our live event was 2021. We spent $4.3 trillion. We have 331.9 million people. So that works out to be $12,956 per person per year, over $1,000 a month. Pretty good.
Yep. And so early, we think, and I'm sure you agree, early and adherent physical therapy or therapy in general is the best way, or one of the best ways to combat that. And so that's what this is all about.
Love it. I lied to you. I have one more question for you.
Nope, that's it.
Any states that, because of the Practice Act or anything like that, that we cannot do RTM in?
So there's definitely some regulations that vary state to state. There's no states we can't do RTM. We utilize, there's different supervision rules state to state. And so, for example, vast majority of states, we can utilize a PTA as a care navigator. That's what we call our person doing the monitoring. We can utilize a PTA if we choose to. Some states require that professional be a PT, just because of supervision rules. But no, there's a way to do it, like Pennsylvania.
Yeah.
There's about 6-7 of them that we know of. You're lucky.
Awesome. Something like that. Yeah. So I'm a practice owner. I'm interested in exploring RTM with Limber. What's the best way for our listeners to get in contact with you, learn more about Limber, and ultimately more about RTM and what it looks like in their practice?
Yeah, and I hope you're hearing from me today that we just want to get the word out about this stuff. And so I would encourage people to reach out, whether they think they're in love with everything we're talking about and like, this is a fit for me, or it's just like, I'd like to hear a little bit more. I got some questions. Please reach out. We set up a landing page just for you guys. And so I would encourage people to go to, it's limberhealth.com/breakthrough. Yeah. So pretty simple. And that's what, they can then submit a demo. Most of those submissions go to me and I'll be reaching out.
Love it. So just to spell that for you, if you're listening right now, and I will put the link in the show notes, but it's Limber Health. That's LimberHealth.com/breakthrough. Limber again is LIMBER health.com/breakthrough. Awesome, Steve. So one more question, final question for you. This one is a personal one. Just to cap off a great episode here. Most influential book in your professional career that you've read and essentially transformed how you thought about
professional
life.
Huh?
Yeah.
There's one called Killer Marketing Secrets.
Get out of here.
I'm just kidding. So I just finished one. I'm going to give you too many answers. I just finished one called Traction that was pretty interesting. I don't know if you've seen that. It's geared a little more towards the tech
Wickman,
industry.
EOS. Yeah.
What's it? You know that one?
Gino Wickman. Traction. I promise you it's by
Okay. I don't want to take credit away from anybody that deserves it.
I literally just talked about it today. Yep.
Okay. The one that, though, of all those kind of like professional related books, the one that stuck with me, the only one that I have ever like given out to people is Atomic Habits.
James Clear.
Yeah. Great. Big fan of that book. And not just on a professional level, I gave it to like my parents, and different things like that. Very
cool. Great. So, love Atomic Habits. And Traction is the EOS. I think is the system that they talk about in their entrepreneurial organization system, something like that.
Maybe two different books by the same name.
I think I literally have it on my shelf right here. But
is it blue?
No, Traction.
It was two different authors. and it's mostly geared towards like the health tech startup industry, but there was definitely some takeaways for healthcare. It's just like different.
I'm very sorry if I.
No,
I actually just want to look this up right now.
let's do it. There's two authors. They co-wrote it.
Yeah, there's definitely a book, Traction by Gino Wickman, that I did look up just to make sure I'm not. Oh yeah, how any startup can achieve explosive customer growth. Gabriel Weinberg and Justin Mares. Looks
That's
like
the one. That's
that I've never heard of before, but glad you brought that up. And
check it out. But Atomic Habits. You read that one first if you're choosing.
Yeah, awesome. Appreciate your time here, Steve. This was great, and thanks for being on the podcast.
Thank you so much, Chad. Really appreciate it.
Right now is a crucial time for private practice physical therapy. I had the chance to talk with hundreds of owners from all over the country, and there's a resounding theme. The story is the same regardless of the state, whether it's Alaska, Arkansas, Florida. It's the same story, and that's there's downward pressure on revenue income into our business and declining reimbursements, and there's upward pressure on the cost to deliver service, to deliver treatment, whether it be employment, space, equipment, etc. And the end result of that is rapidly shrinking profit margins. That's a problem. In the, if you do any research at all, Greg Crabtree says that anytime we, as a practice, service-based business, go under 10% in our margins, we're at risk of closing our doors. In fact, many private practices are closing their doors. However, there may be hope for you. So what we're doing here at Breakthrough is we put together a patient demand summit. It'll be on Thursday, May 25th. We have 8 sessions lined up. It's from 12 noon Eastern to 5 p.m. Eastern Standard Time. You do have to register. This is specifically for private practice owners and their teams. And those 8 sessions will all be geared towards helping you increase your profit margins. So we'll be covering everything from RTM, should you be adding that or adding a cash pay service. We'll be covering how to improve your payer mix and perhaps drop your lowest payer. All things private practice PT focused on increasing your profit margins. The Patient Demand Summit is virtual. It is free, but you do have to register. So click on the link to register. By the way, the alpaca that walked by there, that was our latest edition. Her name is Buffy. She's a couple days old now, I think 2 days old. So here, we'll show you again. There you go. There's Buffy. Nursing, great shot. All right, I'll see you at the Patient Demand Summit.
Remember to visit getbreakthrough.com to access our free resource library designed specifically for private practice growth. While you're there, make sure you register for a complimentary growth assessment to learn about potential opportunities for growth in your local market. Again, thank you for tuning into the Grow Your Practice podcast and supporting our mission to help people in pain get back to normal naturally.